Hi there, my name is Amy Goldberg, and I welcome you to my first show, Checking In with Amy. I am delighted to be here. I work for the Elder Service Plan of the East Boston Neighborhood Health Center, and my job is that I'm a registered nurse, and I've worked there for almost 21 years. It'll be 21 in December, actually, and my main passion is working with people who are in the geriatric population, and the Elder Service Plan is part of the PACE program, which is Program for All-Inclusive Care for the Elderly, but elderly is only 55 years of age and older. So our goal is to keep people living in their homes independently in a healthy manner. So my very first guest today is Dr. Ashley Casey. Welcome,
Thank
Ashley.
you.
And Ashley has her doctor in pharmacy as well as being a registered pharmacist. So now tell me, how did you ever get into that profession?
Well, first of all, thank you for having me here, Amy. I actually became a registered pharmacist. I originally wanted to be a lawyer, and then I became interested in pharmacy when I was working on a case for my boss. He had asked me to go across the street and ask the pharmacist a few questions about the medications that he was working on in a case. So I went across the street and I asked, about the drugs, the side effects, interactions, etc., that would help them in the case. And I was amazed by the amount of knowledge that they had without looking at the computer. It was very natural, and they just had so much knowledge. And I was like, I wanna be like that someday. So my neighbor, he actually worked at Massachusetts College of Pharmacy, or MCP, and he actually took me and my parents on a tour, and I fell in love with it. I applied, I got in.
This is great. And now, I know you were working part-time for us, and now we are so blessed to have you working full-time.
Yep.
So tell me what you're doing.
So right now, I work for the pharmacy, and we work to verify the medications and essentially make sure it's the right drug, the right dose. Now with my full-time position at the health center, I'll be working closely with the providers, with the nursing staff, in determining, drug interactions. Is it the most appropriate therapy for a patient to be on? Minimizing medications if possible. As we know, a lot of elders are on 20 plus medications and there's many interactions. So we try to get that down a bit and just get to the essentials, what people really need. Because sometimes what happens is a cascade of, one medication will cause a side effect, and then you start another medication to treat that side effect. So we try to really look at the patient as a whole and figure out together, as a part of the interdisciplinary team at the health center, what will work best for our patients.
I'm glad you mentioned the word team. So you're one of many team members for the Elder Service Plan. So now my job, what I did was go out to see patients in their home. And when I asked to see their medications, they kind of ran from room to room. One room getting one med, then, it might be in the night table, it's in the bathroom. And it took me quite a while to get them all together. So what kind of systems do you think you could help our viewing audience with to keep it kind of simple?
Well, essentially, you can see here out on the table, we have what's called the medication on time system. And this is something that's pretty unique to our pharmacy. It is used nationwide, but very sparely. We do have, as you can see here, a color-coded system. It's very easy to follow. When you're a member of the Elder Service Plan, you have the choice of using these medication on time systems or vials like most people use currently at a CVS or a Walgreens. But you also can have a medication box. So there are various ways that we try to organize people so that they can take their medications appropriately, because that's obviously the most important part. As you can see on the screen, the medication on time system includes a monthly cycle. So it will have 28 days, and all the scheduled medications are filled at the same time each month and automatically delivered every 4 weeks. The packaging is very easy to follow, and it includes the date, the time, the medication name, directions, and pill description. They're all listed right on the packaging for you to make it really easy to follow. There's also an even start here slot And the patient knows that that's where you start your medications and you just follow along day by day. As you can also see, as I mentioned previously, they are all color-coded. So we have yellow is the 8 a.m., then we have noon here is the white card, then the evening cards are orange, and the blue cards are bedtime doses. So you know you're prompted in the morning, the sun is shining, you take your yellow card. In noontime, you might be watching TV, eating lunch, having a bread sandwich, some white bread, and you go, oh, I'm gonna take my noon meds, and so on and so forth. So we try to make it as easy as possible for people.
Okay.
The other thing that comes with the Medicine on Time system is the physician order. So a physician order will have, as you can see here, it will have a list of all of the medications. It will have the provider's name and how many times a day you take it. So on this one, you'll see that there's 4 times a day, and it will correspond to the 4 times a day dosing that we have in our cards. Sometimes there'll be once a day, and you'll have multiple pills in just one card. The other thing that people find helpful to help keep them organized and to remember when they took their meds is we include a medication supervision record. So this will include the color-coded calendar again, so you can correspond it to each of your cards, and people will check it off or initial saying, you know what, I took my meds, it's the 8th of November, I took them today, and I'm gonna check this off and go on with their day. So these are a few strategies. The other thing that people find helpful if they don't have access to this sort of a system is going down to a regular pharmacy and obtaining a medication box. So the medication box is organized very similarly. Typically you have a setup like the one shown in the picture. You have 7 days, Sunday through Saturday. This particular medication box has multiple time slots per day. However, there are some smaller options available with just 1 time slot per day. Additionally, some may have alarms built in that may beep or alert you to take your medication. And lastly, if someone has bulk items, you'll see here, such as an inhaler. A lot of times people, they'll put that in one room, like you said, they'll put, their medications with the vials in another room, and then of course you have insulin in the fridge. And it's hard to keep those all organized and in one spot. We like to recommend our patients use with something simple. It's a filing box. You can get them very inexpensive at like a local Staples or an office supply stores. And what they do is it's simple, you keep everything in one spot, you can move it around with you, it's easy to carry on a vacation if absolutely necessary. We can put the medication on time, you put your bulk items, and you can put vials in there as well.
That's great. You're making it simple, and it isn't a simple thing. And I think that we need to stress as well that the Elder Service Plan has its own pharmacy, and so you don't have to wait in line at a Walgreens or a CVS or wherever. So now I know how to take them, I know where to keep them, I know a lot about them, but what if they're outdated? How do I know? Because I hear a lot of things that you need to throw away medicines, that they're not effective anymore, but is that true?
No, not necessarily. So one good place, and you can see again on the screen, is the manufacturer's expiration date. So the manufacturer's expiration date is the date beyond which ideally stored medications in an unopened manufacturer's storage container, in most circumstances is unopened, should not be used. So as you can see on the example on the screen, there was the Spiriva inhaler. So you'll see just EXP usually, which stands for an abbreviation for expired. And people will know, okay, it's never been opened, it's good until this date. Once they open, it might not last as long. For instance, with insulin. A lot of times people will store their insulin in the fridge until it's opened, and then you can follow the date that's on the vial until you open it. Once it's opened though, a lot of times medications don't last as long because you're not storing them in the original package. Or once we, in a pharmacy, move it to a vial, for instance, or repackage it into the MOT system. Once it's been repackaged, we refer to the expiration date as a beyond use date. Generally, it says, as you can see on the vial on the screen, discard medication after date. So you can see on the screen the medication was dispensed in November, and then November 2014, and then in November 2015 it will then be considered expired. Generally in a pharmacy, once it's been repackaged, we consider a year expiration date. Often with insulin, again, going back to that example, we'll see that once it's opened, you have 28 days to use it. So a lot of times people might only be using a few units a day, and it could potentially last them 3 months, but you don't want to do that because once it's opened, you're exposing it to constant punctures into the vial, potentially exposing it to, some sort of bacterias, constantly going in and out of the vial. So you want to make sure that once you've used it for 28 days, and a lot of times people will write on the vial the date that they opened it, and then discard it after that date.
That's a big helpful hint.
Yeah.
So now, here's something. I always think that as a nurse, that I'm going to know a lot, and clearly I don't know a lot. So I keep my medicines. You asked me, Amy, where do you keep your meds? And I told you that I keep them in the kitchen, in a cabinet, right near the stove, because that's convenient when I get up in the morning. And so your answer to me about where I keep my medications?
Well, I was shocked, Amy. It's not the best idea to keep it above a stove. For one, the temperature constantly fluctuates in a stove, in a kitchen environment, So you want to definitely make sure you're keeping your medications away from heat. Away from light is the other thing. So if you're keeping it on the counter next to the stove, you're doing two no-nos. You're keeping them exposed to light, exposed to temperature changes, and that will make the drug expire quicker. So it will not work as well over time. And a lot of medications, this can be dangerous, So the best place really to keep medications is probably, like I mentioned, in a box of some sort like this. Keep it in a bedroom. A lot of people like to keep it in maybe a nightside table, in a drawer, away from children, away from pets is obviously very important. You can obviously keep, some people keep them in the bathroom, right? And we discussed this, also not a good idea.
I did that too.
Yeah. Also not a good idea in the bathroom. So we'll have a lot of times people who say, but there's the medication cabinet, that's where I'm supposed to keep it, right? Yeah. And unfortunately, I'm not sure why people started putting medication and medication cabinets in the bathroom. The temperature is constantly fluctuating there too. A lot of times you're taking a steamy shower and then the humidity gets released once you're done, and potentially exposing that medication to the humidity, to the temperature changes. Moisture is another thing, that once the medication gets moist, it could potentially clump together. We've had patients call us and they've, accidentally put too much medication in their hand, they put it back, maybe their hand was wet a little bit, and then for instance, the Docusate will get all stuck together and clumped, and it starts to kind of melt together, and it's, obviously no longer viable. It's not going to work for you anymore. One thing I would actually like to go back to, let me bring an important point, is the timing of medications too. So you mentioned that you keep it next to the stove. It's convenient for you. It helps you remember to take them before you leave in the morning.
Right.
However, a lot of times people can kind of think of other social cues and behaviors that you have, and it's important to think, how I was saying before, you take your morning meds because the sun's shining, it's a cue, take your yellow. However, a lot of times people will set an alarm, and we discussed before, some medication boxes will have alarms. In the Elder Service Program, part of the interdisciplinary team, we have health aides. A lot of times people will be set up, if they have trouble remembering to take their medications, they'll be set up with a health aid reminder. And someone will actually physically go over and say, it's 8 o'clock in the morning, it's time for you to take your meds today. And people find that extremely helpful. And it takes away a lot of that burden on yourself. The other thing that we find is, TV shows. I wake up every morning, I watch the news, right? And you take your morning meds. Every time you see the news, you think, I'm going to take my morning med. And, a lot of times people in the afternoon, they like to watch The Price is Right or so, maybe a favorite, soap opera.
Right.
So they'll coordinate that with, it's my favorite soap opera time. It's time for me to take my noon meds. Dinner time, obviously a lot of times people remember dinner time, you take your evening meds. And then before bedtime. So often it's convenient, to put it by a stove or something if you're only taking it once a day in the morning. But you have to remember, you also get up every morning, right? Keeping it at your bedside table. You look at your bedside table every morning. It's something you don't really think about, but you just open up the drawer. It's time to pop out your morning meds. You follow the date, you follow the time. And I think that people find that a lot helpful. You sewed it up with your social cues.
Right,
Yeah.
I know. And I think it's so interesting because many of the patients that I see each day, there are a lot of issues about them taking their medications properly. And when I look in their bottles, they're full, they're not taking them correctly. So all these are very helpful hints
Yes.
to them. So what about storage in the refrigerator? So I see patients that take insulin. So some people keep it in the refrigerator, some people it's out on the counter, and I don't think everyone knows how to do this.
Yeah. So it is confusing. And even just storage of regular medications, sometimes there's restrictions. A lot of injections like insulin
Right.
have to go into the fridge. It's confusing for some people, but once you maybe open up the dialogue with your pharmacist and figure out what's the best time, what's the best place, what's the best storage conditions, and up on the screen we'll show you some storage do's and don'ts. It's important, especially for insulin, we'll run through this example. Store unopened insulin vials in the refrigerator and follow the expiration date on the box. Once it's been opened, though, they generally expire within 28 days of use, which we've discussed. And once it's opened, you are allowed to keep it at room temperature, so between about 60 or 80 degrees, as long as you're keeping it out of light and away from heat. And that's important for people to remember with, it's winter time. You want to make sure you're not leaving your medications near a radiator as well. That's important. You want to make sure you're always inspecting the contents of your medication. So for instance, with insulin, you want to make sure that you're ensuring the color, the consistency of the product is correct. And you never want to take your insulin if the color or consistency has changed. A lot of times, once it's no longer useful, the medication might get a little clumpy, it might show up a little gray, and you don't want that color or consistency. The other important thing to remember is to never ever freeze insulin. So once it's been frozen, the particles are no longer good for injection. It won't be smooth, it will change color. So it's really important for people to remember at home, never take insulin that's been frozen.
So now our life is awfully busy. Everybody's on the go. There's no time for anything, it appears, in our society. So if I'm a patient and need to take insulin, is there a way that you can take insulin on the go?
Yes, there is actually. So a lot of people now use insulin pens. Insulin pens are easy to carry. They don't have as much of a storage dosage as maybe a vial. A vial is usually 100 units, and depending on how much you're taking, you can get more out of a vial for a longer period of time. But the pens are really convenient. They fit nicely into, for women, a pocketbook, or even men, it might even fit in their pockets, a lot of big pockets. And as long as you're remembering, again, to store them away from heat, away from light. You don't want to forget, if you are storing it in your bag, you don't want to come in, walk in the door when you're done after a long day of being out, maybe socializing with your friends, playing bingo. You don't want to forget and put your bag on the radiator when you come in. A lot of people do that. I've watched my grandmother do it. She takes insulin and she'll do the same thing, and she'll put her insulin pens on the radiator.